row after row, finish a subunit of the face, and then come back and do your PSR3 double pass settings. So here's that added PSR3, where I think the makers of this product are pretty honest. They're not equal to CO2, but they're very good at PSR3 settings. So remember one thing, there's a combination of zone of thermal damage, which is taking out that old layer of skin, the dead skin, the old sun damaged skin, which you see benefits immediately, and the zone of thermal modification, which takes months to begin to see those changes. And the second point to repeat is the fact that the old skin stays intact for several days. That's important as a biologic dressing. These are just some histologic changes, and the point of this slide is not for you to memorize every little histologic architecture, but to understand that the evolution of improvement requires a full year. And during your pre-consultation with a patient, you must convey that information effectively. They will otherwise come back to you at a month and go, how come I wasted my money? You have to educate them that at a high setting, or even a low setting, that collagen remodeling takes a long time. Especially at a low setting, because at a low setting, at PSR1, you don't get that outer layer skin change immediately like you do with a high setting. You're waiting for that modification, that deeper collagen to occur. That takes months. So handhold the patient through that period of time that you have to wait for those changes. So really it's FDA cleared in the United States for wrinkles, for precancerous lesions, the actinic keratoses, and it really helps reduce wrinkles, improve skin texture tone. The acne treatments, I've really only done one lady, and it's still too early for me to say if it works. But reportedly other clinicians have found efficacy and benefit treating acne scars. And remember, just to repeat, that it's a non-chromophore dependent procedure. This is not a laser. It is not a light device. It is a unique modality, a unique treatment method. Sorry for all these words in English. I know that this is not your native language, but this is a lot of information. Anything particularly here? Not really anything here that I would want to address. I think the bottom half of the screen we can talk about. What do you need to know to help take care of a patient? At a low setting, all you need is a hydrating cream on them for about 45 minutes to an hour. There really is almost no discomfort. If you're going to do a high setting, I really, really advocate having the patient under some form of sedation, because just topical anesthetic and even a regional block, great dental block, and extended zygomaticofacial supraorbital blocks, it's still uncomfortable. They need something more. So if you're going to do this, some kind of IV sedation, IM sedation, added PO sedation, something extra to make the patient feel comfortable. That's important. They do feel like a sunburn for the first 3 to 4 hours following the procedure. What I like to do is put back the hydrating cream on for another few hours to help them through that. It's not painful, but it does feel like an intense sunburn that goes away in a few hours and does not come back. These settings here are just to repeat one more time, because there's a lot of information I'm covering. I'm just trying to go through it one more time. Again, the Express is very low energies with no recovery. The PSR1 is a low energy setting that requires multiple treatments, is done as an in-office procedure. And the PSR2, PSR3s are high energy settings. One's a single pass and one's a double pass. And that does have the old skin fall away over a period of that week, and it comes back. That is a real recovery involved. These are some examples of a patient that undergoes a high energy setting, and you can see at 4 joules with a double pass, a PSR3, the old skin turning brown and then sloughing away. And you can see that within about a 7-day period, there is a regeneration of skin. I would say that in an older patient, if you're doing PSR3, double passes, in my experience, you could push that recovery toward day 10. This slide from the company shows improvement over a period of 1 month. I think this is a little bit too early for, in my opinion, to see some of the deeper wrinkle changes. I'm going to show you some of my results as well. This is a PSR3 setting, and you can see that there is pretty quick recovery period over that 7-day period. Although again, I would tell you that it may be a little bit longer than that. One more thing is important when you're treating the patient is be careful keeping all the old stratum corneum intact. You don't want to scrub it away. That is a protective layer during treatment. So no facial scrubs for a week before, and when they come in, no facial scrubs at all, and just gently clean it off. You also want them not to have any kind of acetone or alcohol. This is flammable. So oxygen is turned off for the time of the treatment, and that's very, very important as well. These are some changes. You can see the periorbital improvements in the RHYTECs and the wrinkles there at the high setting, and this is a regional treatment of PSR3. Regional meaning that they only treated one part of the face. I have never done that, except a touch-up on a person that had it done somewhere else. But otherwise, I generally speaking don't do that. The company argues that even in a sun-damaged skin, you're not going to see a line of demarcation. I don't know. I mean, I don't have any experience. I just usually treat the whole face. Another example of a PSR3 high setting with you can see that improvement takes months to start showing the changes. And again, you can see the changes in the superficial dyschromias as well as the superficial RHYTECs, and the texture and tone of the skin has improved over 3 months. Close-up photographs, some of the brown is improved and the texture tone is improved. And that's a realistic example of the RHYTECs near the eye are not entirely gone. It's the deeper wrinkles oftentimes don't necessarily completely go away with this. They do get improvement though, and I'm going to show you some of my results in a moment. And again, you can see in a close-up macro photography the improvement in the skin architecture. Another example here. Another example. Another lady that I did upper blephs, fat grafting, and plasma, and this is about 3 months out, and there's still a few RHYTECs around the mouth. That does take a while for it to soften as time goes by, but there's a nice improvement in the texture tone of the skin, and this is a realistic example of the improvements you can achieve. Just to express my bias again, I tend to be much more combining fat grafting and plasma as one treatment because I like the results of doing both. Although in your hands you may be focused more on just doing plasma. This is about 4 months out. You can still see some of the RHYTECs around the mouth, but otherwise a nice improvement in the texture tone of the skin and improvement overall. So in summary, this is a brand new technology. It is not a laser, it is not a light device. And you can choose between high and low settings, although if you're dealing with the Fitzpatrick 4 and beyond, which probably is mainly here in Bogota, you probably are dealing primarily with doing the lower PSR1 settings. And there is a nice change for the aging face improvement with, I would say, the safety and recovery of a peel with a result that approximates but does not equal CO2. It's an easy procedure to do, but you have to have good hand control doing it because you don't want to burn the patient. You have to keep a non-contact distance during the whole delivery. There's also, just to reiterate, I didn't stress this, is there's no eyewear. Since this is non-chromophore dependent, it's a safe procedure. It's just basically nitrogen gas. And it can be used in the neck, chest, and hands, but at low settings. And that may be something that you may be interested in combining with your rejuvenation. I like to do it in combination with other procedures. I tend not to do it in isolation as much. That's how I run my practice. And that's it. I guess, are we on time? Great.